Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Today is the ninth and the last lecture of inflammation, healing, and repair. The objectives of this lecture are to continue the healing of skin wound by secondary union or second intention, to know the differences between the primary and the secondary union, and to understand the factors that affect wound healing. Wounds which heal by secondary union or second intention are infected wound, contaminated wound, larger wounds, and wounds with widely separated edges. So, healing of skin wound by second intention or secondary union, it occurs in larger wounds that have wide gaps between the wound margins, while in the primary union, the wound is small, clean, surgical incision, and approximated by sutures. Fibrosis predominates over epithelial regeneration in secondary union, while in the primary union, epithelial regeneration predominates over fibrosis. Healing is slower, with more intense inflammation and more granulation tissue formation, with more scarring, while healing in the primary or secondary union is faster, with minimal inflammation, minimal granulation tissue formation, and a small scar is formed. Examples of secondary union occurs in infarction, large wounds, large burns, ulcers, and abscess due to the excessive tissue loss. So healing is by secondary union. This picture shows the difference between the primary and secondary union. Healing by first intention or primary union, surgical incision, small, clean, uninfected, and approximated by suture. While healing in secondary union, there is large tissue defect. The edges are widely separated. As in this picture, this is a large burn. The difference is clear between the primary and secondary union. So, secondary union differs from primary union by the following. As we said, first, large tissue loss with the large defect lead to the formation of larger blood clot with large scar is formed at the surface of the wound, and this requires more time to close. Acute inflammation is more severe in secondary union than primary union. So, there is larger volume of granulation tissue is formed to fill the gap or tissue lost or the defect, resulting in the formation of hypertrophied scar or keloid formation. Fourth, wound contraction or contraction. What is mean? In large skin defects, there is a reduction in the size of the wound surface by 5 to 10% from its original size. يعني انكماش الجرح due to the or caused by contraction of myofibroblast, producing limitation of joint movement or hand claw deformities. Myofibroblasts are modified fibroblasts, have the features of contractile smooth muscle cells. So it is called myo. Myo means smooth muscle. Fibroblast. Okay, this is modified fibroblast. Has feature of smooth muscles, causing contraction of the wound. And the contraction of the wound leading to the limitation of joint movement or hand claw deformities. So contracture is defined by a deformity in the extremities with the limitation of joint movement, which cannot be fully extended. This picture shows there is limitation of the movement of index finger due to the wound contraction. This is means wound contraction. مفهوم؟ يعني wound contracture is a reduction in the size of the wound by 5 to 10% from its original size. This diagram shows the difference in healing by first intention or primary union and healing by second intention or secondary union by using timeline. As we see, in the first 24 hours. In this healing by first intention, there is surgical incision, small in size, small blood clot, fill the gap, and small scar on the surface of the wound. Minimal inflammation with neutrophil infiltration. While in healing by second intention, you see there is large tissue defect or large tissue loss with large gap, and this leads to the formation of large blood clot to fill the gap, and large scar cover the surface of the wound. Acute inflammation is more intense. During the 3 to 7 days of healing, granulation tissue is formed. In the first intention, there is minimal volume of granulation tissue, while in the healing by second intention, you see there is a large volume, a large amount of granulation tissue is formed to fill the defect. Later on, there is formation of fibrous scar or fibrous union. In first intention, the scar is small in size with minimal contraction. You see, this is on the surface, minimal contraction. While in healing by second intention, there is wound contraction or contraction. As you see, there is the breast and the surface of the skin. There is depression due to the contraction, which is produced by myofibroblast, reduction in the size of the wound. Okay? Clear? Any question? is meant by skin graft? A large wound in which re-epithelialization or epithelial or epidermal regeneration is delayed or impossible. So the skin is covered, the wound is covered by skin graft. Skin graft usually taken from the skin of the thigh and graft the area of wound. Clear؟ مفهوم؟ سكين الجراف يستخدم عادة when يكون regeneration is delayed or impossible because why graft. فعادة يأخذون السكين جراف from بتاعي لأن الثاي بد مكان مختفي يعني ما يظهر للعين حتى إذا كانت كونت فيه إسكار أو ما ظاهر فدائما يأخذون من السكين of the thigh. فهذا معنى السكين جراف. What is mean by wound strength? Wound strength معناتها قوة الجرح. It is depend on the suturing. Wound strength depend on the suture. Sutured wound has 70% of normal skin strength due to the presence of the suture. Presence of the suture give strength to the wound. يعني وجود السوتشر تعطي قوة للجرح. At the end of the first week, usually the sutures are removed. So the wound strength becomes 10% of normal skin. Means the wound is weak. Any movement, any torsion, any pressure is opened. At the end of the third month, the wound strength becomes 70 to 80% of normal skin strength. Why? Due to the deposition of collagen and remain forever and don't progress beyond that point. يبقى قوة 70 إلى 80% من قوة الجلد الطبيعي بعد ما يرجع إلى 100% of the normal skin strength. مفهوم؟ فالخطورة وين راح تكون؟ after removal of the suture. الواحد يكون حذر. أي حركة أي التواء ممكن أن ينفتح الجرح. We comes to the complication of wound healing. The most important complication of wound healing are infections. The first, infection. Second, wound dehiscence and ulceration. Wound dehiscence means the wound fall apart. Opening of the wound dehiscence means. Third, implantation dermal cyst. What is mean? Epidermis integral downward to the dermis with the formation of cyst followed by keratin. نعرف احنا الابيديرمس شنو secrete keratin. The implantation dermal cyst means epidermis go downward to the dermis. نعرف انه الابيديرمس secrete keratin, forming cyst within the dermis followed by keratin. For keloid formation and hypertrophied scar. Fifth, uniform scar and weak scar. Weak scar may produce incisional hernia. You know hernia? especially in the wound of the abdominal wall. If the wound is weak, this will lead to the protrusion or bulging of the all abdominal organs and tissue, causing incisional hurt. Incisional means because of the surgical incision. Pigmented scar sometimes, as we say, formation of wound contracture, cicatrization, تمزق بالنسيج. 9. Neoplastic changes, such as development of squamous cell carcinoma and rarely basal cell carcinoma of the skin at the site of the wound, especially in the old burn scars and chronic ulcer. When the chronic ulcer develop squamous cell carcinoma, rarely basal cell carcinoma of the skin, is called marjoline ulcer. What is meant by marjoline ulcer? Marjoline ulcer is malignant tumor of the skin, especially squamous cell carcinoma, developed at the site of the wound. Occurs in all burn scars or chronic ulcer. And the last complication is exuberant granulation tissue formation with excessive amount of deposition of granulation tissue. You will see the pictures of these complications. As we said, one complication is the development of ulcer. So this is different types of ulcer. This is arterial ulcer. This is pressure ulcer. This is pressure ulcer, especially occurs in the back or in the area where there is pressure. And this is venous stasis ulcer in the leg due to the varicose vein. So these are chronic ulcer. May develop malignancy or malignant tumor in the skin, squamous cell carcinoma, which is called marjoline ulcer. But this is one complication of ulceration in the skin, most likely because of infection. This is also pictures of complication of wound healing. This is a wound dehiscence. You see, there is a splitting and opening of the wound called wound dehiscence. This is because of infections or due to the deficient scar formation with inadequate granulation tissue or collagen deposition. They lead to the pull about or opening or splitting of the wound called wound dehiscence. As we said, also skin ulceration or wound ulceration as a complication. This is keloid formation, which is hypertrophied scarring tissue. This is a keloid formation, and this is contraction with hand claw deformity due to the wound contraction occurs in the old burn scar This is burn scar and produce hand claw deformity because of contraction, means a reduction in the size of the wound due to the contraction of myofibroblast, not fibroblast, myofibroblast. This is keloid. What is keloid? Keloid is raised, ugly looking, hypertrophied scarring tissue. Keloid has genetic predisposition. Commonly seen in black-skinned or dark-skinned minor trauma. Keloid develop without any trauma or without any injury to the skin. Keloid separate and progress beyond the original area of wound. Separate and extend beyond the original area of skin wound and increasing in size with the time and never progress, never regress, increasing with the time. As you see, this is feature of keloid. Treatment of keloid is not surgical excision because surgical excision causes recurrent and increasing size of keloid. So the treatment of keloid by intralesional injection of steroid or laser therapy. As we said, keloid has a genetic predisposition common in black skin or dark skin people. Common signs of keloid are upper chest, shoulder, upper arm, and upper back. This is also keloid. You see, it is arranged, ugly looking, hypertrophied scarring tissue. The keloid progress and extend beyond the original area of wound. And common sign, you see, shoulder, upper back, upper arm, and upper chest. And increasing in size with the time. There is a progression without regression in size. Keloid is more common in female because of piercing of earlobe. The piercing of earlobes produce large keloidal masses. You see, ugly looking keloidal masses. There is difference between hypertrophic scar and keloid. Hypertrophic scar should be differentiated from keloid. Hypertrophic scar is limited to the original area of skin wound without separate or progression beyond the original area, decreasing in size with the time, and regression or fading out with the time. it has no genetic predisposition, occurs equally in male and female, and can occur in any site in the body. So this is hypertrophic scar. This is keloid. You see hypertrophic scar, keloid treatment, يا اما intralesional injection of steroid or laser therapy, just to reduce the size of the keloid and prevent abrogation or increasing in size. An intralesional steroid injection or laser therapy and other types of treatment. But surgical treatment cause increasing in size of keloid and recurrent. Why? لأن by surgical treatment شو يسوي؟ جاي يسوي انت تروما في الجلد. والكوز اوف ذا كيلويد هي تروما. ايضا يحصل بعض الاحيان without any تروما. ماكو اي تروما ولا اكو اي انجري بالسكن، بس يشوف البيشنت developed كيلويد. فاي تروما لما تسوي اكسجين راح تسوي تروما للجلد. راح تسبب increasing in the size of keloid and recurrent. بعكس الهايبرتروفيك سكار. هايبرتروفيك سكار لا، with the time راح decrease in size، يصغر حجمها وممكن ان تختفي. بس مرات for cosmetic reason يسووا لها surgical excision. هايبرتروفيك سكار. فواحد لازم يفرق ما بين الهايبرتروفيك سكار وما بين الكيلويد. Hypertrophic scar limited to the area of injury without spread or extend beyond the original area of wound, while keloid spread, you see, spread and extend beyond the original area of wound. Keloid has genetic predisposition, more common in black-skinned people, while hypertrophic scar has no genetic predisposition. Keloid more common in female. Hypertrophic scar occurs equally in both male and female. Also, there is difference in the treatment. Surgical excision in hypertrophic scar and keloid never use surgical excision, because of causing increasing the size of keloid and recurrent keloid. واضح the difference between hypertrophic scar and keloid. But by histopathological examination, by microscopical examination, they are the same. Keloid and hypertrophic scar, there is excessive haphazard deposition of collagen in the dermis, producing raised dermal mass. By histological examination, the same. Excessive deposition and haphazard deposition of collagen in the dermis, producing dermal mass raised over the skin. واضح the difference between keloid and hypertrophic scar. This picture shows this is exuberant granulation tissue. This is red, pinkish granular tissue. Exuberant, excessive amount of granulation tissue is one complication of wound healing. And this excessive amount of granulation tissue prevents or blocks the regeneration of the epidermis. So, this requires surgical excision or cauterization of the granulation tissue. واضح؟ This is the picture of exuberant granulation tissue. إذا كان هذا one complication of wound healing، فما ممكن أن يصير healing بهذا الجرح، لأن الجرانيوليشن تيشو جاي يمنع regeneration of epidermis. شلون تعالجه؟ يا اما surgical excision أو cauterization بالقطر تشيل الgranulation tissue to start epithelial regeneration and revitalization. So this is exuberant granulation tissue is one complication of wound healing. أي سؤال واضح؟ We come to the factors affecting wound healing or influence wound healing. There are local factors and systemic factors. The most important factor cause delay in wound healing are infections and diabetes. These are the most important factors cause delay in wound healing or impair the wound healing. Infections and diabetes. We come to the local factors, means factors related to the skin or local in the area of wound. Local factors are first, infection. As we said, infection is the single most important cause of delay in wound healing. Second, poor blood supply due to the local venous obstruction, atherosclerosis, and diabetes will delay the wound healing. Example, the tibial skin wound heals much slower than wound in the face. Why? Because good blood supply in the upper part of the body and the face than the lower part of the body and the legs. So this is related to the blood supply. Mechanical factors such as increased local pressure, torsion, excessive movement, all these cause wound to pull apart, open, and cause wound hemolysis. الواحد منحدر خصوصا بعد ما ترفع الخيوط after removing of the suture at the end of the first week. Any torsion, any pressure may lead to the wound hemolysis. The wound is off. Radiation therapy inhibits cell proliferation so that radiotherapy for malignant tumors is delayed until the surgical scar has been completely healed. يعني surgical scar completely healed يلا واحد يبدي radiotherapy عادة after month of the operation. بعد شهر من العملية يلا يبدي واحد radiotherapy. Why? Because radiotherapy inhibits the cell proliferation and the skin wound never heal because of radiation. واحد ما ينطي radiotherapy وأسبوع من العملية. مثلا patient عنده CA breast ويرفعوا لها فد ما استفدت. أو patient عنده CA colon وسووا له collective. لازم يسوون abdominal incision. Until these scars completely heal, we start the radiotherapy. Why? Radiotherapy inhibits the cell proliferation. Presence of the foreign body in the wound also causes delay in wound healing. Adhesion to a bony surface when the wound adheres to the bony surface, healing is delayed because of poor blood supply. Neoplastic changes or tumor when developed in the area of chronic ulcers or old burn scar which is called margarine ulcer. It prevents healing of the wound. إذا شفنا الجرح ما جاي ينقلب، فواحد ياخذ باله إنه أخاف يتحول إلى سرطان جلد. واحد يسوي له أكسجين، يهز له الهيستوباثولوجيكال إكزامينيشن حتى يعرف إيش السبب ما جاي يصير هيلينج بالوند. طبعا الهيستولوجيكال إكزامينيشن ممكن أن نشوف إنه كونت سيكوينال سيل كارسينوما، سرطان بالجلد at the site of chronic ulcer. And the last local factors are the type and the extent of tissue injury, location of injury, and the character of the tissue in which the injury occurs also are important. You know, the tissue of the body, depending on regenerative capacity, are divided into labile, stable, and permanent tissue. So there is regeneration in the labile and stable tissue, while permanent tissue, there is no regeneration and healing by fibrosis. This is the type of tissue. And the extent of injury. If there is large amount of tissue loss, affect the healing. And the character of the tissue means the type of tissue. The inflammation of, example, inflammation of the dural, peritoneal, or synovial cavity. It produces fibrinous inflammation. And if there is excessive amount of fibrin, lead to the organization. So depending on the character of the tissue, which is involved by injury or inflammation. So all these factors affect wound healing, but they are local factors related to the site of the wound. Systemic factors, they are general factors, such as protein calorie malnutrition, affect wound healing. Vitamin C and zinc deficiency inhibit collagen synthesis, as in cases of severe burn and intestinal fissure, cause zinc deficiency. And also diabetes mellitus, the most important cause of delay in wound healing, diabetes. Corticosteroid treatment also inhibits fibrosis. They never give corticosteroid treatment, whether oral or local, when there is limit. It is inhibit the fibrosis and delay in wound healing. Renal failure also cause delay in wound healing. Hematological diseases such as leukemia and neutropenia, decrease neutrophil count, cause delay in wound healing. Tumor cachexia, patient with cancer. The patient weak, pallor, low immunity. So this is called the tumor cachexia. Interfere with the healing of the wound. And also the age of the patient. You know, healing is better in the children and young patients than elderly patients. These are the systemic factors affecting or causing delay in wound healing. مفهوم؟ We come to the summary of mechanism of wound healing. The summary يعني شنو ما تكلمنا عنه بالمحاضرة عن الwound healing، هاي المحاضرة والمحاضرة السابقة، فهذا هو السمري. شنو يحصل بالwound healing؟ First، أول يحصل acute inflammation، then regeneration of epidermis، Third, formation of new blood vessels by angiogenesis with fibroblast proliferation. 3 and 4 bonds means granulation tissue formation. Then deposition of extracellular matrix and collagen synthesis and deposition. Later on, maturation and scar remodeling by collagenase and gelatinase cause collagen degradation, and any excess collagen is removed. This means scar removal, collagen degradation, and any excess collagen is removed by collagenase and gelatinase. So this is mean maturation and remodeling of the scar. But this is the steps of wound healing. These mechanisms are complicated process, and they are controlled by a variety of mechanisms. Wound healing is a complicated process, and it should be controlled by mechanism. Why? Which control? Why? To prevent the development of tumor and cancer. إذا كان الوند هيلينج مو تحت سيطرة الجسم، شو راح يسبب؟ راح يسبب ورم وسرطان، لأن ماكو شيء جاي يسيطر عليه. شنو عندنا احنا؟ proliferation of cells. proliferation of cells إذا ماكو عليها سيطرة شو راح تسبب لنا؟ producing tumor، ورم، mass or cancer. فمن العوامل اللي بتسيطر على الwound healing. The most important mechanisms are or factors. First, chemical mediators play important role in controlling the wound healing. Second, growth factors such as epidermal growth factor, platelet-derived growth factor, transforming growth factor alpha, fibroblast growth factor, and others. These factors stimulate the proliferation and differentiation of the cells. And there is growth inhibitors, such as tumor suppressor genes and transforming the growth factor beta. You see, transforming the growth factor alpha as the growth factor stimulate proliferation and differentiation of the cell, while transforming the growth factor beta, growth inhibitors, tumor suppressor gene, and transforming growth factor beta inhibit the proliferation of the cells and prevent the development of tumor or cancer. So, any mutation in these tumor suppressor gene and transforming growth factor beta, any mutation, any change in these factors lead to the loss of growth inhibition, reducing cancer or lead to the development of tumor. And the growth inhibition. What is meant by growth inhibition? When the cells are grown in the tissue culture outside the body, the cells proliferate and reach to the certain concentration, stop proliferation. Why? Because cell beside the cell inhibit the proliferation. This is called contact inhibition. يعني شافوا من الخلايا تنزل على التشيو كلتشر خارج الجسم يصير بها proliferation بس توصل إلى حد معين وتوقف البروليفريشن مالته. شوف ليش؟ لأن تكون الخلايا وحدة بصف الثانية راح تؤدي إلى inhibit proliferation. بينما بالكانسر وبالتيومر الكونتاكت انهبيشن لوس ما لهذا تتكاثر الخلايا بدون ان اي احد يخمدها. The contact inhibition loss in the development of a tumor and cancer. فمفهوم contact inhibition. And the last one is extracellular matrix. For all these four factors are important in the controlling cell proliferation and differentiation to prevent the development of cancer or tumor. You know, differentiation means the proliferative cells should be similar to the cells of origin or to the mother cells. الخلايا المتكونة لازم تشبه خلية الأم. إذا فقدت اللوس of differentiation فقدت درجة التمايز lead to the development of cancer. مفهومة؟ mechanism of wound healing والميكانيزم اللي بيسيطر على الwound healing. Thank you very much and good luck. معكم أي سؤال أي استفسار؟ واضحة المحاضرة؟ واضحة الآن فيهم؟